Hello and welcome. Today, we're delving into Stargardt disease, a genetic eye disorder that affects central vision. Join us as we explore the causes, symptoms, diagnosis, and management of this condition. Stargardt disease is primarily caused by mutations in the ABCA4 gene. This gene provides instructions for making a protein essential for transporting vitamin A byproducts in the retina. When the ABCA4 gene malfunctions, these byproducts, specifically lipofuscin, accumulate in the retinal pigment epithelium, or RPE, ultimately leading to cellular damage and vision loss. In most cases, Stargardt disease is inherited in an autosomal recessive pattern, meaning that both parents must carry a copy of the mutated gene for their child to develop the condition. The pathophysiology of Stargardt disease centers around the buildup of lipofuscin within the RP cells. These cells support the photoreceptor cells in the retina, which are responsible for detecting light. The accumulation of lipofuscin impairs the function of the RPE, leading to the degeneration of photoreceptors, particularly in the macula. The macula is the central part of the retina responsible for sharp, detailed vision. As these cells die off, central vision progressively declines. Stargardt disease is considered the most common form of inherited macular degeneration. It typically affects about 1 in 8,000 to 10,000 individuals. While it can manifest at any age, symptoms most often appear in childhood or adolescence. The prevalence is consistent across different ethnicities and geographical locations, suggesting the genetic mutation is widespread. The hallmark symptom of Stargardt disease is progressive central vision loss. Individuals often describe blurry or distorted vision, difficulty reading, and trouble recognizing faces. Another common symptom is the appearance of small, yellow-white spots called flecks in the macula and surrounding retina. These flecks represent the lipofuscin deposits. Sensitivity to bright light or photophobia and color vision deficiencies may also occur. Diagnosing Stargardt disease typically involves a comprehensive eye exam. This includes assessing visual acuity, examining the retina for flecks, and evaluating color vision. Optical coherence tomography, or OCT, is often used to visualize the retinal layers and assess the extent of damage to the macula. Fundus autofluorescence imaging helps to detect the presence and distribution of lipofuscin deposits. Genetic testing can confirm the diagnosis by identifying mutations in the ABCA4 gene. While Stargardt disease is primarily one condition resulting from ABCA4 gene mutations, variations in the severity and progression can be observed among individuals. Some classifications are based on the age of onset and the extent of retinal involvement, but these are not formal types. It's more accurate to describe it as a spectrum of disease severity. Currently, there is no cure for Stargardt disease. Treatment focuses on managing symptoms and slowing the progression of vision loss. Low vision aids, such as magnifying glasses and electronic devices, can help individuals maximize their remaining vision. Sunglasses and hats are recommended to protect the eyes from bright light. Clinical trials are underway to investigate potential therapies, including gene therapy, stem cell therapy, and medications aimed at reducing lipofuscin accumulation. Unfortunately, there are currently no known preventative measures for Stargardt disease, as it is a genetically inherited condition. Genetic counseling is recommended for individuals with a family history of the disease who are planning to have children. This counseling can help assess the risk of passing on the mutated gene. The prognosis for individuals with Stargardt disease varies. While most experience a gradual decline in central vision, the rate of progression can differ significantly. Vision loss typically stabilizes at some point, although the level of vision retained varies. Research is rapidly advancing, with promising gene therapy trials underway. These trials aim to deliver a functional copy of the ABCA4 gene to the retina, potentially halting or even reversing the disease. Stem cell therapies are also being explored as a way to replace damaged RPE cells. The future holds hope for more effective treatments and potentially a cure for Stargardt disease. Thank you for joining us.